1. Hand hygiene is the single most effective way to prevent the spread of infection in healthcare settings. True or false? Answer: true. Rationale: proper hand hygiene, including hand washing and alcohol-based hand rubs, is the cornerstone of infection prevention, as emphasized by the CDC and WHO, reducing healthcare-associated infections significantly. 2. Standard precautions apply only to patients with confirmed infectious diseases. True or false? Answer: false. Rationale: standard precautions apply to all patients, regardless of infection status, to prevent transmission of pathogens via blood, body fluids, or mucous membranes, as per CDC guidelines. 3. The nurse should raise the side rails for a patient at risk for falls. True or false? Answer: true. Rationale: raising side rails is a safety intervention for patients at risk for falls, particularly those with altered mental status or mobility issues, to prevent injury, per Joint Commission standards. 4. Verbal orders should never be accepted by a nurse. True or false? Answer: false. Rationale: verbal orders can be accepted in urgent situations, but must be documented immediately and verified by the prescriber within a specified timeframe, per facility policy and safety standards. 5. Turning a patient every 2 hours prevents pressure injuries. True or false? Answer: true. Rationale: repositioning every 2 hours redistributes pressure, promotes circulation, and prevents pressure injuries in immobile patients, as recommended by wound care guidelines. 6. A blood pressure of 140/90 mmHg is considered normal for an adult. True or false? Answer: false. Rationale: a blood pressure of 140/90 mmHg is classified as stage 1 hypertension per the American Heart Association, requiring monitoring and possible intervention, not considered normal. 7. Hypokalemia can cause muscle weakness and arrhythmias. True or false? Answer: true. Rationale: hypokalemia, low potassium, disrupts muscle and cardiac function, leading to weakness, cramps, and arrhythmias, requiring electrolyte replacement and monitoring. 8. Medications should be administered within 15 minutes of the scheduled time. True or false? Answer: false. Rationale: medications should be administered within 30 to 60 minutes of the scheduled time, per facility policy, to maintain therapeutic levels, unless specified as time-critical. 9. Non-pharmacological pain interventions include guided imagery. True or false? Answer: true. Rationale: guided imagery is a non-pharmacological pain intervention that uses relaxation and visualization to reduce pain perception, complementing pharmacological approaches. 10. Nurses can delegate vital sign measurements to unlicensed assistive personnel. True or false? Answer: true. Rationale: nurses can delegate stable vital sign measurements to trained unlicensed assistive personnel, but must interpret results and assess unstable patients themselves, per scope of practice. 11. Informed consent is required only for surgical procedures. True or false? Answer: false. Rationale: informed consent is required for any invasive procedure, treatment, or research, ensuring patients understand risks, benefits, and alternatives, per ethical and legal standards. 12. Cultural competence includes respecting a patient's dietary preferences. True or false? Answer: true. Rationale: cultural competence involves respecting and accommodating patients' cultural beliefs, including dietary preferences, to provide patient-centered care and build trust. 13. Therapeutic communication avoids using open-ended questions. True or false? Answer: false. Rationale: therapeutic communication encourages open-ended questions to elicit patient concerns and promote dialogue, fostering trust and understanding in the nurse-patient relationship. 14. A pulse oximetry reading of 88% is within normal limits. True or false? Answer: false. Rationale: a pulse oximetry reading below 95% indicates hypoxemia, requiring assessment and intervention, as normal oxygen saturation is 95 to 100% in healthy adults. 15. Personal protective equipment, PPE, is required only for airborne precautions. True or false? Answer: false. Rationale: PPE is required for all transmission-based precautions, airborne, droplet, contact, and certain standard precaution scenarios, depending on the risk of exposure, per CDC guidelines. 16. The nurse should check 2 patient identifiers before administering medication. True or false? Answer: true. Rationale: checking 2 patient identifiers, e.g., name, date of birth, before medication administration ensures patient safety and prevents errors, per Joint Commission standards. 17. Fluid overload can cause peripheral edema and shortness of breath. True or false? Answer: true. Rationale: fluid overload increases intravascular volume, leading to peripheral edema and pulmonary congestion, causing shortness of breath, requiring monitoring and diuretics. 18. Pain assessment is only necessary for postoperative patients. True or false? Answer: false. Rationale: pain assessment is essential for all patients, as pain can occur in various conditions, e.g., chronic illness, trauma, guiding appropriate interventions, and improving comfort. 19. Nurses are legally responsible for reporting suspected abuse. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected abuse or neglect, e.g., child, elder, domestic, to authorities, per state laws and ethical obligations. 20. A patient's chart should include only objective data. True or false? Answer: false. Rationale: a patient's chart includes both objective data, e.g., vital signs, lab results, and subjective data, e.g., patient complaints, history, to provide a comprehensive clinical picture. 21. Proper body mechanics prevent nurse injuries during patient transfers. True or false? Answer: true. Rationale: using proper body mechanics, e.g., bending knees, keeping back straight, reduces musculoskeletal strain and prevents injuries when transferring patients, per OSHA guidelines. 22. Oral care should be performed only once daily for bedridden patients. True or false? Answer: false. Rationale: oral care should be performed at least twice daily, or more frequently, for bedridden patients to prevent infections, maintain comfort, and promote oral health. 23. The 5 rights of medication administration include right documentation. True or false? Answer: true. Rationale: the 5 rights of medication administration are right patient, drug, dose, route, and time, with right documentation often considered a 6th right to ensure accuracy and accountability. 24. A temperature of 37.5 degrees Celsius is considered febrile. True or false? Answer: false. Rationale: a temperature of 37.5 degrees Celsius (99.5 degrees Fahrenheit) is slightly elevated, but not typically considered febrile, which is defined as 38 degrees Celsius (100.4 degrees Fahrenheit) or higher, requiring further assessment. 25. Restraints should be used as the first intervention for agitated patients. True or false? Answer: false. Rationale: restraints are a last resort for agitated patients. After de-escalation, environmental modifications, and other interventions fail, per CMS and Joint Commission standards. 26. Active listening is a key component of therapeutic communication. True or false? Answer: true. Rationale: active listening, including eye contact and nonverbal cues, demonstrates empathy and encourages patients to express concerns, enhancing therapeutic communication. 27. Hypocalcemia can cause tetany and seizures. True or false? Answer: true. Rationale: hypocalcemia, low calcium, disrupts nerve and muscle function, leading to tetany, muscle spasms, and potentially seizures, requiring calcium replacement and monitoring. 28. Nurses should administer medications prepared by another nurse. True or false? Answer: false. Rationale: nurses must prepare and administer their own medications to ensure accuracy and prevent errors, verifying the drug, dose, and patient, per medication safety protocols. 29. Non-slip socks are a fall prevention strategy for hospitalized patients. True or false? Answer: true. Rationale: non-slip socks provide traction, reducing fall risk for patients, especially those with mobility issues, as part of a comprehensive fall prevention plan. 30. Incident reports are included in the patient's medical record. True or false? Answer: false. Rationale: Incident reports are separate from the medical record, used for quality improvement and risk management, to maintain confidentiality and avoid legal implications. 31. A respiratory rate of 10 breaths per minute is normal for an adult at rest. True or false? Answer. False rationale. A normal respiratory rate for an adult at rest is 12 to 20 breaths per minute. 10 breaths per minute indicates bradypnea, requiring further assessment. 32. Standard precautions include wearing gloves during all patient interactions. True or false? Answer. False rationale. Standard precautions require gloves only when contact with blood, body fluids, or mucous membranes is likely, not for all interactions, to balance safety and practicality. 33. The nurse should assess a patient's pain using a 0 to 10 scale. True or false? Answer. True rationale. The 0 to 10 numeric pain scale is a standard tool to quantify pain intensity, aiding in assessment, treatment planning, and evaluation of interventions. 34. Nurses can share patient information freely with family members. True or false? Answer. False rationale. Nurses must protect patient confidentiality under HIPAA, sharing information with family only with patient consent or in specific circumstances, per legal and ethical standards. 35. Sequential compression devices prevent deep vein thrombosis. True or false? Answer. True rationale. Sequential compression devices promote venous return in immobile patients, reducing the risk of deep vein thrombosis, a common complication in hospitalized patients. 36. A patient's weight should be measured weekly in the hospital. True or false? Answer. False rationale. A patient's weight should be measured daily or as ordered in the hospital to monitor fluid status, nutritional needs, or medication dosing, especially in critical conditions. 37. The nurse should document care before it is provided. True or false? Answer. False rationale. Documentation should occur after care is provided to ensure accuracy and reflect actual interventions, per nursing standards and legal requirements. 38. Elevating the head of the bed reduces aspiration risk in enteral feeding. True or false? Answer. True rationale. Elevating the head of the bed to 30 to 45 degrees during enteral feeding reduces the risk of aspiration by promoting gastric emptying and preventing reflux. 39. Nurses are responsible for verifying informed consent before procedures. True or false? Answer. True rationale. Nurses verify that informed consent is documented and the patient understands the procedure, ensuring ethical practice, though the provider obtains the consent. 40. A heart rate of 110 beats per minute is normal for an adult at rest. True or false? Answer. False rationale. A normal resting heart rate for an adult is 60 to 100 beats per minute. 110 beats per minute indicates tachycardia, requiring assessment for causes like pain or anxiety. 41. Droplet precautions require a surgical mask for all patient interactions. True or false? Answer. True rationale. Droplet precautions require a surgical mask during close contact, within 3 to 6 feet, to prevent transmission of pathogens like influenza, per CDC guidelines. 42. Pain is always a physical sensation in patients. True or false? Answer. False rationale. Pain can be physical, emotional, or psychological, influenced by factors like anxiety or cultural beliefs, requiring a holistic assessment for effective management. 43. Nurses can modify a patient's care plan without consulting the healthcare team. True or false? Answer. False rationale. Nurses collaborate with the healthcare team to modify care plans, ensuring interventions align with medical orders and patient needs, per interprofessional standards. 44. Proper hand hygiene includes washing hands for at least 20 seconds. True or false? Answer. True rationale. The CDC recommends washing hands with soap and water for at least 20 seconds to effectively remove pathogens, a critical step in infection control. 45. Hyponatremia can cause confusion and seizures. True or false? Answer. True rationale. Hyponatremia, low sodium, disrupts neurological function, leading to symptoms like confusion, seizures, or coma, requiring careful sodium correction and monitoring. 46. The nurse should use a draw sheet to reposition a patient in bed. True or false? Answer: true. Rationale: a draw sheet reduces friction and shear, protecting the patient's skin and easing repositioning while minimizing nurse strain, per safe patient handling guidelines. 47. All patients should be bathed daily with soap and water. True or false? Answer: false. Rationale: daily bathing with soap and water may not be appropriate for all patients, e.g., those with dry skin or critical conditions, requiring individualized hygiene plans. 48. The nurse should report a medication error immediately. True or false? Answer: true. Rationale: immediate reporting of medication errors ensures patient safety, allows for timely intervention, and supports quality improvement per facility policy and ethical standards. 49. Cultural competence requires ignoring a patient's spiritual beliefs. True or false? Answer: false. Rationale: cultural competence involves respecting and integrating a patient's spiritual beliefs into care, promoting trust and holistic patient-centered care. 50. A patient's advance directive must be followed in all situations. True or false? Answer: false. Rationale: an advance directive guides care but may not apply in all situations, e.g., reversible conditions or unclear wishes, requiring consultation with the healthcare team and family. 51. Contact precautions require gloves and a gown for all patient interactions. True or false? Answer: true. Rationale: contact precautions require gloves and a gown to prevent transmission of pathogens like MRSA or C. difficile during patient interactions, as per CDC guidelines. 52. The nurse should assess a patient's fall risk only upon admission. True or false? Answer: false. Rationale: fall risk should be assessed upon admission and ongoingly, e.g., with shift changes or condition changes, to ensure safety, per Joint Commission standards. 53. SBAR is a structured communication tool for handoff reports. True or false? Answer: true. Rationale: SBAR situation, background, assessment, recommendation, standardizes communication during handoffs, improving clarity and patient safety as endorsed by the Institute for Healthcare Improvement. 54. Bed baths are necessary for all hospitalized patients daily. True or false? Answer: false. Rationale: bed baths are individualized based on patient needs, skin condition, and mobility. Some patients may require partial baths or alternative hygiene methods to avoid skin irritation. 55. A pulse rate of 55 beats per minute is normal for an adult at rest. True or false? Answer: false. Rationale: a pulse rate of 55 beats per minute is below the normal range, 60 to 100 beats per minute, for an adult at rest, indicating bradycardia, which requires further assessment. 56. Hypernatremia can cause thirst and confusion. True or false? Answer: true. Rationale: hypernatremia, high sodium, causes cellular dehydration, leading to thirst, confusion, and potentially seizures, requiring fluid administration and monitoring. 57. The nurse should double-check high-risk medications like insulin before administration. True or false? Answer: true. Rationale: high-risk medications like insulin require a double check by 2 nurses to verify dose and patient, reducing errors per medication safety protocols. 58. Massage is a safe pain relief method for all patients. True or false? Answer: false. Rationale: massage is contraindicated in patients with conditions like deep vein thrombosis or skin infections, as it may worsen complications, requiring careful assessment. 59. Nurses are ethically obligated to advocate for patient autonomy. True or false? Answer: true. Rationale: the ANA Code of Ethics emphasizes patient autonomy, requiring nurses to support patients' informed decisions and preferences in care planning. 60. Documentation should include only positive patient outcomes. True or false? Answer: false. Rationale: documentation must include all relevant data, including negative outcomes, complications, or unchanged conditions, to ensure accuracy and continuity of care. 61. Ambulating a patient early after surgery prevents complications. True or false? Answer: True rationale. Early ambulation post-surgery promotes circulation, prevents deep vein thrombosis, and enhances recovery, as supported by enhanced recovery protocols. 62. Alcohol-based hand rubs are effective against Clostridium difficile spores. True or false? Answer. False rationale. Alcohol-based hand rubs are ineffective against C. difficile spores, requiring hand washing with soap and water to physically remove spores, per CDC guidelines. 63. The nurse should use a tympanic thermometer for all patients. True or false? Answer. False rationale. Tympanic thermometers are not suitable for all patients, e.g., those with ear infections or infants, requiring alternative methods like oral or rectal for accuracy. 64. A patient's cultural beliefs should be ignored during care planning. True or false? Answer. False rationale. Cultural beliefs must be integrated into care planning to provide patient-centered care, respecting preferences and building trust, per ANA standards. 65. Therapeutic communication includes maintaining eye contact with all patients. True or false? Answer. False rationale. Eye contact should be culturally sensitive, as some patients may find it uncomfortable or disrespectful, requiring nurses to adapt communication techniques. 66. Incentive spirometry prevents postoperative atelectasis. True or false? Answer. True rationale. Incentive spirometry encourages deep breathing, expanding alveoli, and preventing atelectasis in postoperative patients as part of respiratory care protocols. 67. Medications can be crushed for administration without verification. True or false? Answer. False rationale. Crushing medications, e.g., extended release or enteric-coated, can alter their pharmacokinetics, requiring verification with a pharmacist to ensure safety. 68. A blood pressure cuff that is too small can falsely elevate readings. True or false? Answer. True rationale. A too small blood pressure cuff increases pressure on the arm, falsely elevating readings, requiring proper cuff sizing for accurate measurement, per AHA guidelines. 69. Nurses should report all changes in patient condition to the physician immediately. True or false? Answer. False rationale. Nurses assess and prioritize changes, reporting significant or urgent changes immediately, while documenting and monitoring minor changes, per clinical judgment. 70. Proper lifting techniques include keeping the load close to the body. True or false? Answer. True rationale. Keeping the load close to the body during lifting reduces spinal strain and leverages core strength, preventing injuries, per OSHA safe handling guidelines. 71. A patient's pain level should be assessed only when they request pain medication. True or false? Answer. False rationale. Pain should be assessed regularly, not only on patient request, to ensure timely intervention and effective management, per pain management standards. 72. Airborne precautions require a negative pressure room. True or false? Answer. True rationale. Airborne precautions for pathogens like tuberculosis require a negative pressure room to prevent pathogen spread, as mandated by CDC infection control guidelines. 73. Fluid restriction is appropriate for all patients with heart failure. True or false? Answer. False rationale. Fluid restriction is individualized for heart failure patients based on severity and symptoms. Some may require monitoring without strict restriction to avoid dehydration. 74. The nurse should verify a patient's allergies before administering medication. True or false? Answer. True rationale. Verifying allergies prevents adverse reactions, ensuring patient safety, and is a critical step in the medication administration process, per Joint Commission standards. 75. Advance directives are only for terminally ill patients. True or false? Answer. False rationale. Advance directives apply to any adult patient, specifying care preferences for future incapacity, not just terminal illness, per ethical and legal standards. 76. A respiratory rate of 22 breaths per minute is normal for an adult at rest. True or false? Answer. False rationale. A respiratory rate of 22 breaths per minute is above the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating tachypnea. requiring assessment. 77. Hand hygiene is required only before invasive procedures. True or false? Answer: false. Rationale: hand hygiene is required before and after patient contact, before aseptic tasks, and after exposure risks, not only for invasive procedures, per WHO guidelines. 78. The nurse should use a gait belt when assisting a patient with ambulation. True or false? Answer: true. Rationale: a gait belt provides support and stability, reducing fall risk during ambulation, especially for patients with weakness or balance issues, per safety protocols. 79. All patient complaints should be documented as subjective data. True or false? Answer: true. Rationale: patient complaints, e.g., pain, nausea, are subjective data, reflecting their personal experience, and must be documented accurately to guide care, per charting standards. 80. Hypomagnesemia can cause cardiac arrhythmias. True or false? Answer: true. Rationale: hypomagnesemia, low magnesium, disrupts cardiac electrical activity, potentially causing arrhythmias like torsades de pointes, requiring magnesium replacement. 81. Nurses can administer expired medications in emergencies. True or false? Answer: false. Rationale: expired medications may lose potency or become unsafe and should not be administered, even in emergencies, per medication safety and regulatory standards. 82. Elevating the legs reduces edema in patients with venous insufficiency. True or false? Answer: true. Rationale: elevating the legs promotes venous return, reducing edema in patients with venous insufficiency as part of non-pharmacological management. 83. The nurse should interrupt a patient during therapeutic communication to provide education. True or false? Answer: false. Rationale: interrupting a patient during therapeutic communication hinders active listening and trust building, requiring nurses to allow patients to express concerns fully. 84. A temperature of 36.5 degrees Celsius is considered hypothermic. True or false? Answer: false. Rationale: a temperature of 36.5 degrees Celsius is within the normal range, 36 to 38 degrees Celsius. Hypothermia is defined as below 35 degrees Celsius, requiring warming interventions. 85. Nurses are responsible for ensuring a safe environment for patients. True or false? Answer: true. Rationale: nurses must maintain a safe environment by removing hazards, ensuring equipment functionality, and implementing safety protocols per patient safety standards. 86. All patients require a full body assessment every shift. True or false? Answer: false. Rationale: assessment frequency and scope depend on patient condition. Stable patients may require focused assessments, while unstable patients need comprehensive ones. 87. The nurse should use sterile gloves for all wound care. True or false? Answer: false. Rationale: sterile gloves are required for open or surgical wounds, but clean gloves are sufficient for chronic or superficial wounds, per infection control guidelines. 88. Pain management includes assessing the patient's cultural beliefs about pain. True or false? Answer: true. Rationale: cultural beliefs influence pain expression and management preferences, requiring nurses to assess and incorporate them for effective, patient-centered care. 89. Incident reports are shared with the patient's family. True or false? Answer: false. Rationale: incident reports are internal documents for quality improvement and risk management, not shared with families to maintain confidentiality and avoid legal issues. 90. A heart rate of 90 beats per minute is normal for an adult at rest. True or false? Answer: true. Rationale: a heart rate of 90 beats per minute is within the normal range, 60 to 100 beats per minute, for an adult at rest, indicating stable cardiac function. 91. Droplet precautions are required for all respiratory infections. True or false? Answer: false. Rationale: droplet precautions are specific to infections like influenza or pertussis, while other respiratory infections, e.g., tuberculosis, require airborne precautions per CDC guidelines. 92. Fluid overload can be assessed by monitoring daily weights. True or false? Answer: true. Rationale: Daily weights are a sensitive indicator of fluid status, with a 1 kilogram increase reflecting approximately 1 liter of fluid retention, guiding fluid overload management. 93. Nurses can ignore a patient's refusal of treatment. True or false? Answer: false rationale. Nurses must respect a patient's right to refuse treatment, documenting the refusal and notifying the provider per ethical and legal principles of autonomy. 94. Proper hand hygiene includes drying hands thoroughly after washing. True or false? Answer: true rationale. Thoroughly drying hands prevents skin irritation and reduces pathogen transmission, as wet hands can harbor bacteria, per WHO hand hygiene guidelines. 95. Hyperkalemia can cause muscle cramps and cardiac arrest. True or false? Answer: true rationale. Hyperkalemia, high potassium, disrupts muscle and cardiac function, causing cramps, weakness, and potentially lethal arrhythmias or cardiac arrest, requiring urgent intervention. 96. The nurse should reposition a patient only when they request it. True or false? Answer: false rationale. Repositioning every 2 hours is standard for immobile patients to prevent pressure injuries, regardless of patient request, per wound care guidelines. 97. Medication reconciliation is only performed upon discharge. True or false? Answer: false rationale. Medication reconciliation occurs at admission, transfer, and discharge to ensure accuracy and prevent errors, per Joint Commission patient safety goals. 98. A warm compress is a non-pharmacological comfort measure for pain. True or false? Answer: true rationale. A warm compress promotes muscle relaxation and blood flow, reducing pain in conditions like muscle spasms as a non-pharmacological comfort measure. 99. Nurses can share patient information with colleagues in public areas. True or false? Answer: false rationale. Sharing patient information in public areas violates HIPAA, requiring nurses to discuss patient details only in private settings to protect confidentiality. 100. The nurse should assess a patient's skin integrity during every bath. True or false? Answer: true rationale. Assessing skin integrity during baths identifies early signs of breakdown or injury, enabling timely interventions to maintain skin health, per nursing standards. 101. The nurse should use a clean technique for urinary catheter insertion. True or false? Answer: false rationale. Urinary catheter insertion requires a sterile technique to prevent urinary tract infections, as the procedure involves an invasive entry into a sterile body system, per CDC guidelines. 102. A patient's bed should be kept in the lowest position to prevent falls. True or false? Answer: true rationale. Keeping the bed in the lowest position reduces the risk of injury from falls, especially for patients with mobility issues or altered mental status, per Joint Commission safety standards. 103. Handoff reports should include only the patient's current condition. True or false? Answer: false rationale. Handoff reports should include the patient's current condition, medical history, recent changes, and care plan to ensure continuity of care, per SBAR communication guidelines. 104. Perineal care is only necessary for incontinent patients. True or false? Answer: false rationale. Perineal care is necessary for all patients, especially those with limited mobility, to prevent skin breakdown and infections, not just those with incontinence, per hygiene standards. 105. A pulse oximetry reading of 96% is normal for an adult at rest. True or false? Answer: true rationale. A pulse oximetry reading of 96% is within the normal range, 95 to 100%, for an adult at rest, indicating adequate oxygenation, per respiratory assessment standards. 106. Hypomagnesemia can cause muscle tremors and seizures. True or false? Answer: true rationale. Hypomagnesemia, low magnesium, disrupts neuromuscular function, leading to tremors, seizures, or arrhythmias, requiring magnesium replacement and monitoring. 107. The nurse should administer medications immediately after drawing them up. True or false? Answer: false rationale. Medications should be administered after verifying the patient's identity and the 5 rights, not immediately after preparation, to prevent errors per medication safety protocols. 108. Relaxation techniques are effective for managing acute pain. True or false? Answer. False rationale. Relaxation techniques are more effective for chronic or mild pain, while acute pain often requires pharmacological interventions per pain management guidelines. 109. Nurses must obtain a signed consent form for all treatments. True or false? Answer. False rationale. Signed consent is required for invasive procedures or high-risk treatments, but not for routine care like medication administration, per ethical and legal standards. 110. Reflective listening enhances therapeutic communication. True or false? Answer. True rationale. Reflective listening, restating or paraphrasing a patient's concerns, validates their feelings and fosters trust, a key component of therapeutic communication. 111. Contact precautions are only for patients with confirmed infections. True or false? Answer. False rationale. Contact precautions are used for suspected or confirmed infections, e.g., MRSA, to prevent transmission, as per CDC infection control guidelines. 112. The nurse should check the bed alarm for a patient at risk for falls. True or false? Answer. True rationale. Bed alarms alert staff to patient movement, reducing fall risk for high-risk patients as part of a comprehensive fall prevention plan per safety standards. 113. Vital signs should be taken only once per shift. True or false? Answer. False rationale. Vital signs should be taken as ordered or based on patient condition, often multiple times per shift, to monitor trends and detect changes per assessment protocols. 114. Proper body alignment reduces pressure on joints during patient positioning. True or false? Answer. True rationale. Proper body alignment distributes weight evenly, reducing pressure on joints and preventing discomfort or injury, per safe patient handling guidelines. 115. A blood pressure of 110/70 mmHg is considered hypertensive. True or false? Answer. False rationale. A blood pressure reading of 110/70 mmHg is within the normal range, which is defined as less than 120/80 mmHg according to the American Heart Association guidelines. Therefore, it is not considered hypertensive. 116. Fluid balance is monitored by assessing intake and output. True or false? Answer. True rationale. Measuring intake and output provides accurate data on fluid balance, detecting imbalances like dehydration or overload per nursing assessment standards. 117. The nurse should use a medication's trade name in documentation. True or false? Answer. False rationale. Documentation should use the generic name of medications to ensure clarity and avoid confusion, as trade names vary per charting standards. 118. Distraction is a non-pharmacological intervention for pain. True or false? Answer. True rationale. Distraction, such as music or conversation, redirects attention from pain, reducing perception, and is an effective non-pharmacological intervention. 119. Nurses can override a patient's advance directive in emergencies. True or false? Answer. False rationale. Advance directives must be followed in emergencies unless unclear or inapplicable, requiring consultation with a healthcare team per ethical standards. 120. Cultural competence includes using a professional interpreter for non-English speaking patients. True or false? Answer. True rationale. Using a professional interpreter ensures accurate communication and respects cultural needs, improving care quality for non-English speaking patients per ANA standards. 121. Airborne precautions are required for all viral infections. True or false? Answer. False rationale. Airborne precautions are specific to pathogens like tuberculosis or measles, while other viral infections, e.g., influenza, require droplet precautions per CDC guidelines. 122. The nurse should assess a patient's respiratory rate for a full minute. True or false? Answer. True rationale. Assessing respiratory rate for a full minute ensures accuracy, especially for irregular patterns, providing reliable data for clinical decisions per assessment standards. 123. All medications require a physician's order for administration. True or false? Answer: true rationale. Medications require a physician's or authorized prescriber's order to ensure safety and legality, except in specific protocols, per nursing practice regulations. 124. A warm bath is contraindicated for patients with fever. True or false? Answer: false rationale. A warm or tepid bath can help reduce fever by promoting heat loss through evaporation, a safe non-pharmacological intervention, per fever management guidelines. 125. Restraints can be applied without a physician's order in emergencies. True or false? Answer: true rationale. In emergencies, restraints can be applied to protect the patient or others, but a physician's order must be obtained promptly, per CMS and Joint Commission standards. 126. Therapeutic communication includes giving advice to patients. True or false? Answer: false rationale. Therapeutic communication avoids giving advice, instead encouraging patients to explore their own solutions to promote autonomy and coping, per communication principles. 127. Hypercalcemia can cause constipation and lethargy. True or false? Answer: true rationale. Hypercalcemia, high calcium, slows gastrointestinal motility and affects neurological function, causing constipation, lethargy, and potentially confusion. 128. The nurse should administer medications through a nasogastric tube without checking placement. True or false? Answer: false rationale. Nasogastric tube placement must be verified, e.g., via pH testing or X-ray, before medication administration to prevent aspiration, per safety protocols. 129. A bedridden patient's linens should be changed daily. True or false? Answer: true rationale. Daily linen changes for bedridden patients prevent skin breakdown, maintain hygiene, and promote comfort, per standard nursing care protocols. 130. Incident reports are used to punish nurses for errors. True or false? Answer: false rationale. Incident reports are for quality improvement and risk management, identifying system issues, not for punishing nurses, per facility and safety standards. 131. A temperature of 38.5 degrees Celsius is considered normal. True or false? Answer: false rationale. A temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit indicates fever, not normal, 36 to 38 degrees Celsius, requiring assessment and intervention, per fever management guidelines. 132. The nurse should use a transfer board for patients with limited mobility. True or false? Answer: true rationale. A transfer board facilitates safe movement for patients with limited mobility, reducing injury risk for both patient and nurse, per safe handling guidelines. 133. Pain assessment is only required for patients with visible injuries. True or false? Answer: false rationale. Pain assessment is required for all patients, as pain can be internal or chronic, e.g., neuropathy, guiding appropriate interventions, per pain management standards. 134. Nurses are responsible for ensuring medication reconciliation at admission. True or false? Answer: true rationale. Nurses participate in medication reconciliation at admission to verify current medications, preventing errors, per Joint Commission patient safety goals. 135. A heart rate of 50 beats per minute is normal for an adult at rest. True or false? Answer: false rationale. A heart rate of 50 beats per minute is below the normal range, 60 to 100 beats per minute, for an adult at rest, indicating bradycardia, requiring assessment. 136. Standard precautions include wearing a mask during all patient interactions. True or false? Answer: false rationale. Standard precautions require a mask only for procedures with splash risk, e.g., suctioning, not all interactions, per CDC infection control guidelines. 137. Fluid overload can cause weight gain and jugular vein distension. True or false? Answer: true rationale. Fluid overload increases intravascular volume, causing weight gain and jugular vein distension, indicating potential heart failure, per assessment standards. 138. Nurses can share patient information with other nurses during shift changes in public areas. True or false? Answer: false rationale. Patient information must be shared privately during shift changes to protect confidentiality, avoiding public areas, per HIPAA regulations. 139. The nurse should apply moisturizer to a patient's skin during hygiene care. True or false? Answer. True. Rationale. Applying moisturizer prevents skin dryness and breakdown, especially in immobile or elderly patients, as part of routine hygiene care. 140. Ethical nursing practice includes respecting a patient's right to refuse care. True or false? Answer. True. Rationale. Respecting a patient's right to refuse care upholds autonomy, a core principle of ethical nursing practice, per the ANA Code of Ethics. 141. Droplet precautions require a private room for the patient. True or false? Answer. False. Rationale. Droplet precautions do not always require a private room. Cohorting with similar infections is acceptable if a mask is worn, per CDC guidelines. 142. The nurse should document a patient's response to pain medication. True or false? Answer. True. Rationale. Documenting a patient's response to pain medication evaluates effectiveness and guides further treatment, ensuring continuity of care, per charting standards. 143. All patients should be encouraged to ambulate immediately after surgery. True or false? Answer. False. Rationale. Ambulation post-surgery depends on the patient's condition and surgical type. Some require delayed ambulation to prevent complications, per recovery protocols. 144. A cold compress can reduce swelling and acute injuries. True or false? Answer. True. Rationale. A cold compress reduces swelling by constricting blood vessels and decreasing inflammation in acute injuries, per non-pharmacological intervention guidelines. 145. Nurses can delegate medication administration to unlicensed assistive personnel. True or false? Answer. False. Rationale. Medication administration is a nursing responsibility and cannot be delegated to unlicensed assistive personnel, per scope of practice and safety standards. 146. Cultural competence includes avoiding assumptions about a patient's beliefs. True or false? Answer. True. Rationale. Cultural competence requires nurses to avoid assumptions and assess each patient's beliefs individually to provide respectful, patient-centered care. 147. A respiratory rate of 16 breaths per minute is normal for an adult at rest. True or false? Answer. True. Rationale. A respiratory rate of 16 breaths per minute is within the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating stable respiratory function. 148. The nurse should administer medications prepared by a pharmacy technician. True or false? Answer. False. Rationale. Nurses must verify medications prepared by others, ensuring the 5 rights, and should not administer without checking, per medication safety protocols. 149. Proper hand hygiene includes using hand sanitizer before gloving. True or false? Answer. True. Rationale. Hand sanitizer before gloving reduces pathogen load on hands, enhancing infection control, especially for non-sterile procedures, per CDC guidelines. 150. Incident reports are required for all medication errors. True or false? Answer. True. Rationale. All medication errors, even near misses, require an incident report to analyze causes, improve systems, and enhance patient safety, per facility policies. 151. The nurse should use a sterile technique for dressing changes on surgical wounds. True or false? Answer. True. Rationale. Sterile technique is required for surgical wound dressing changes to prevent infection, as these wounds are at high risk for contamination, per infection control guidelines. 152. All patients require call light within reach only during the day shift. True or false? Answer. False. Rationale. A call light must be within reach at all times, day or night, to ensure patient safety and access to assistance, per Joint Commission standards. 153. Documentation should include the nurse's initials and credentials. True or false? Answer. True. Rationale. Including initials and credentials in documentation ensures accountability and identifies the responsible nurse, per legal and charting standards. 154. Daily shampooing is necessary for all hospitalized patients. True or false? Answer. false rationale. Daily shampooing is not necessary for all patients and may dry the scalp. Hair care should be individualized based on patient needs and condition, per hygiene protocols. 155. A blood pressure of 130/85 mmHg is considered normal for an adult. True or false? Answer: false rationale. A blood pressure reading of 130/85 mmHg is classified as stage 1 hypertension, not normal. According to the American Heart Association guidelines, normal blood pressure is defined as less than 120/80 mmHg. A reading of 130/85 mmHg requires monitoring and appropriate management. 156. Hypernatremia can cause seizures and coma. True or false? Answer: true rationale. Hypernatremia, high sodium, causes cellular dehydration, leading to neurological symptoms like seizures and coma, requiring careful fluid management per electrolyte balance protocols. 157. The nurse should administer medications without verifying the patient's identity. True or false? Answer: false rationale. Verifying the patient's identity using two identifiers is critical to prevent medication errors per the 5 rights of medication administration and Joint Commission standards. 158. Deep breathing exercises can reduce pain perception. True or false? Answer: true rationale. Deep breathing exercises promote relaxation and oxygenation, reducing pain perception as a non-pharmacological intervention, per pain management guidelines. 159. Nurses can withhold information from patients to avoid distress. True or false? Answer: false rationale. Withholding information violates patient autonomy and trust. Nurses must provide honest, appropriate information per the ANA Code of Ethics and Patient Rights. 160. Silence is an effective therapeutic communication technique. True or false? Answer: true rationale. Silence allows patients to process emotions and share concerns, fostering trust and reflection as a key therapeutic communication technique. 161. Standard precautions apply only to patients with visible wounds. True or false? Answer: false rationale. Standard precautions apply to all patients to prevent transmission of pathogens via blood, body fluids, or mucous membranes, regardless of visible wounds, per CDC guidelines. 162. The nurse should lock wheelchair brakes before transferring a patient. True or false? Answer: true rationale. Locking wheelchair brakes ensures stability during transfers, preventing falls and ensuring patient safety, per safe patient handling protocols. 163. Vital signs should be taken only when the patient is symptomatic. True or false? Answer: false rationale. Vital signs should be taken routinely as ordered or based on protocol, not only when symptomatic, to establish baselines and detect changes, per assessment standards. 164. Proper positioning includes supporting a patient's limbs with pillows. True or false? Answer: true rationale. Supporting limbs with pillows maintains alignment, reduces pressure, and enhances comfort, especially for immobile patients, per nursing care standards. 165. A pulse rate of 120 beats per minute is normal for an adult at rest. True or false? Answer: false rationale. A pulse rate of 120 beats per minute is above the normal range, 60 to 100 beats per minute, for an adult at rest, indicating tachycardia, requiring assessment. 166. Strict intake and output monitoring is required for all hospitalized patients. True or false? Answer: false rationale. Strict intake and output monitoring is required for patients with conditions like renal failure or fluid overload, but not all patients, based on clinical need, per nursing protocols. 167. The nurse should document medication administration before giving the dose. True or false? Answer: false rationale. Documentation should occur after medication administration to ensure accuracy and confirm the dose was given, per legal and charting standards. 168. Guided imagery is a non-pharmacological comfort measure for anxiety. True or false? Answer: true rationale. Guided imagery uses visualization to reduce anxiety and promote relaxation, serving as an effective non-pharmacological comfort measure per holistic care principles. 169. Nurses can ignore a patient's cultural dietary restrictions. True or false? Answer: false rationale. Nurses must respect cultural dietary restrictions to provide patient-centered care and build trust, coordinating with dietitians as needed, per ANA standards. 170. The nurse should report suspected patient neglect to authorities. True or false? Answer: true rationale. Nurses are mandated reporters and must report suspected neglect to authorities, ensuring patient safety per state laws and ethical obligations. 171. Airborne precautions are required for Clostridium difficile infections. True or false? Answer: false rationale. Clostridium difficile requires contact precautions, not airborne, as it spreads via fecal-oral transmission, per CDC infection control guidelines. 172. A temperature of 37.0 degrees Celsius is considered febrile. True or false? Answer: false rationale. A temperature of 37.0 degrees Celsius is within the normal range, 36 to 38 degrees Celsius. Fever is defined as 38 degrees Celsius or higher, requiring further assessment, per fever management guidelines. 173. Sequential compression devices are used for all surgical patients. True or false? Answer: false rationale. Sequential compression devices are used for surgical patients at risk for deep vein thrombosis, not all patients, based on risk assessment, per postoperative care protocols. 174. The nurse should assess pain using only verbal reports from the patient. True or false? Answer: false rationale. Pain assessment includes verbal reports, nonverbal cues, e.g., grimacing, and behavioral changes, especially for nonverbal patients, per pain management standards. 175. Nurses are responsible for verifying the accuracy of physician orders. True or false? Answer: true rationale. Nurses must verify physician orders for clarity, appropriateness, and safety, questioning discrepancies to prevent errors, per nursing practice standards. 176. A respiratory rate of 30 breaths per minute is normal for an adult at rest. True or false? Answer: false rationale. A respiratory rate of 30 breaths per minute is above the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating tachypnea, requiring assessment. 177. Hand hygiene is required after removing gloves. True or false? Answer: true rationale. Hand hygiene after glove removal removes potential pathogens from hands, as gloves may have microtears, per CDC infection control guidelines. 178. The nurse should assist a patient with ambulation only after surgery. True or false? Answer: false rationale. Ambulation assistance is needed for any patient with mobility issues, not only post-surgery, to prevent falls and promote independence, per safety protocols. 179. All patient assessments should be documented in the medical record. True or false? Answer: true rationale. All assessments must be documented to ensure continuity of care, support clinical decisions, and meet legal requirements, per charting standards. 180. Hypokalemia can cause constipation and fatigue. True or false? Answer: true rationale. Hypokalemia, low potassium, impairs muscle function, including gastrointestinal motility, causing constipation and fatigue, requiring electrolyte correction. 181. Medications can be left at the patient's bedside for self-administration. True or false? Answer: false rationale. Medications must be administered by the nurse to ensure safety and compliance, not left at the bedside, except in specific self-administration programs, per safety protocols. 182. Elevating the head of the bed improves breathing in patients with dyspnea. True or false? Answer: true rationale. Elevating the head of the bed to 30 to 45 degrees facilitates lung expansion and reduces dyspnea, per respiratory care standards. 183. Therapeutic communication includes using medical jargon with patients. True or false? Answer: false rationale. Therapeutic communication uses clear, simple language to ensure patient understanding, avoiding medical jargon, per communication principles. 184. A cold pack is contraindicated for chronic pain. True or false? Answer: false rationale. Cold packs can be used for chronic pain in some cases, e.g., inflammation, though heat is often preferred, depending on the condition, per pain management guidelines. 185. Nurses can delegate patient assessments to unlicensed assistive personnel. True or false? Answer: false rationale. Patient assessments require nursing judgment and cannot be delegated to unlicensed assistive personnel, per scope of practice and safety standards. 186. Cultural competence includes respecting a patient's spiritual practices. True or false? Answer: true rationale. Respecting spiritual practices is part of cultural competence, ensuring holistic, patient-centered care and fostering trust, per ANA standards. 187. A heart rate of 80 beats per minute is normal for an adult at rest. True or false? Answer: true rationale. A heart rate of 80 beats per minute is within the normal range, 60 to 100 beats per minute, for an adult at rest, indicating stable cardiac function. 188. The nurse should administer medications without checking the expiration date. True or false? Answer: false rationale. Checking the expiration date ensures medication safety and efficacy, preventing administration of ineffective or harmful drugs, per medication safety protocols. 189. Proper hand hygiene includes using soap and water for visibly soiled hands. True or false? Answer: true rationale. Soap and water are required for visibly soiled hands to physically remove dirt and pathogens, as hand sanitizer is less effective, per CDC guidelines. 190. Incident reports are used to document routine patient care. True or false? Answer: false rationale. Incident reports are for unexpected events or errors, not routine care, to analyze risks and improve safety, per facility and quality improvement standards. 191. Droplet precautions require a mask only during procedures. True or false? Answer: false rationale. Droplet precautions require a mask during close contact, within 3 to 6 feet, with the patient, not only during procedures, to prevent transmission, per CDC guidelines. 192. Fluid balance can be assessed by checking skin turgor. True or false? Answer: true rationale. Poor skin turgor indicates dehydration, a key assessment for fluid balance, along with other signs like mucous membrane dryness, per nursing protocols. 193. Nurses can modify a patient's diet without a physician's order. True or false? Answer: false rationale. Diet modifications require a physician's or dietitian's order to ensure medical appropriateness, with nurses coordinating and educating, per care standards. 194. A warm compress can relieve muscle spasms. True or false? Answer: true rationale. A warm compress promotes muscle relaxation and blood flow, relieving spasms, as a non-pharmacological comfort measure, per pain management guidelines. 195. Nurses are responsible for ensuring a patient's informed consent is documented. True or false? Answer: true rationale. Nurses verify that informed consent is documented before procedures, ensuring ethical practice, though the provider obtains the consent, per standards. 196. A respiratory rate of 10 breaths per minute is normal for an adult at rest. True or false? Answer: false rationale. A respiratory rate of 10 breaths per minute is below the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating bradypnea, requiring assessment. 197. Hand hygiene is required only before patient contact. True or false? Answer: false rationale. Hand hygiene is required before and after patient contact, before aseptic tasks and after exposure risks, per WHO and CDC infection control guidelines. 198. The nurse should use a draw sheet only for incontinent patients. True or false? Answer: false rationale. A draw sheet is used for repositioning any immobile patient, not only incontinent ones, to reduce friction and prevent skin injury, per safe handling protocols. 199. Pain management includes reassessing pain after interventions. True or false? Answer: true. Rationale: reassessing pain after interventions evaluates effectiveness and guides further treatment, ensuring optimal pain control per pain management standards. 200. Advance directives are legally binding in all situations. True or false? Answer: false. Rationale: advance directives guide care but may not be binding in all situations, e.g., unclear wishes or emergencies, requiring team consultation per legal standards.